All right, so first you got to make sure the BFR unit is plugged in. So there's a plug in right over here, and the black cord just plugs into the back of the BFR here. So make sure that's plugged in, otherwise it'll die on you. And then we're gonna put the metal clip into the metal insert here until you hear that click. And then you're gonna take a plastic clip, the white clip, and you're gonna attach it to the plastic red cuff until you hear that click. Okay, and then we're gonna set up Caleb here. So we're gonna put this sleeve, red sleeve, on Caleb's throwing arm. We're only testing the throwing arm. And we're going as proximal as we can, or as close to the armpit as we can. And when we put the cuff on, we're going to have the white tab pointing up towards his head and on the outside of his arm. And then we're gonna pull this snug. So you don't have to crank on it, but you want it to be somewhat tight. And then we can have Caleb just stand here and just relax. If he fights this cuff, it might beep at you and you might have to lay him down to get it to do it correctly. But if he stays kind of relaxed in this position, it should work just in standing. So now I'm gonna turn the machine on this button here. Okay, and it's just calibrating here. And then it's gonna preset to the leg. So if you can see this little guy right here, his leg is highlighted. So we wanna click on that guy. And then we wanna make sure we're on upper. And then we wanna make sure it reads strength, or STR means strength. So we're gonna click that, maybe. And now you can see the arm is highlighted. Okay, so first we're gonna test, if this is your first time using it, you're gonna test his personalized tourniquet pressure, which is the blue button. You're gonna have him stay relaxed. I'm gonna press that button. And that's gonna restrict his blood flow at 100% to get our baseline number. So we'll let that work. If he stays relaxed, it should work well. If he's trying to fight the cuff, again, it might just beep at you. It's not a big deal. You just got to repeat the step and maybe move the cuff around to make sure it fits well. So you can see the blood flow is starting to diminish there. So give it some time to work. There's his 100% on the top. And then the arm is going to work at 50% of that number. So he's going to be working at 80 millimeters of mercury. So we hit the green check button, the green check mark, and now it's preset for whoever is going, right? And that's at 80. So now once we're done with that, we can inflate it to green, right? So we're going to hit the green inflate button, and it's going to go to his green line, and now he's ready to go.